We're going to talk about the median nerve today, which is really important for upper limb pain. It can cause carpal tunnel where it comes into the wrist. People might complain of shoulder issues, pain reaching back into the back of the car, reaching to put on a seat belt or taking your coat off. And it's all this tension going from where the nerves originate from your neck down into your arm. So we're going to talk about some neural sliders which are really effective to mobilize the nerve and free it up. So nerves need to slide and glide through your tissues. This can be impeded if your muscles are tight in your shoulder or into your arm. So if someone's hammering, doing housework, or it's part of their job, or there's repeated wrist flexion and extension, either in sport or with working at the keyboard, causing the muscles to be tight over where they overlay the nerve. So this is going to mobilize the nerve and just free it up, which will help your symptoms. So I'm going to use a little prop today. It's a piece of TheraTube. And when you pull the TheraTube tight, it's actually about the diameter of your median nerve. So first of all, I'm going to just show you the course of the median nerve, or where it goes from and to. So I'm going to use this. This is going to start from your neck. I'm going to put this around my middle finger, and it comes out through the arm and, like I said, into the wrist there. So I'd like to thank David Butler, who coined this technique and who I'm borrowing it from. So from its origin in your neck, if you put it on a tensioner, you're going to abduct the arm, take it away from the side of your body, extend your elbow and extend your wrist, and take your head away. And you can see in this position that the band is at the tightest point it can go. So that's a tensioner. But what we want to do is a slider. So we want to slide the nerve along its pathway and just free it up. So you're going to go into the tension position, but when the wrist goes down, you're going to bring your head towards your wrist, and then you can tension it from the other end, from the neck, and you're going to bring your head to the opposite side and wrist towards you. So it's like your wrist and your head are attached. Whichever way they go together. And that slides the nerve along its pathway and freeze it up. So you're going to do this about 8 to 10 times, and it's normal that you shouldn't feel too much as you're doing this exercise, but this shows you that something is actually happening. So it's not a muscle stretch, it's more of a nerve slider. So you might do this twice a day, but not too much, because nerves are irritable, and if it causes you any pain, stop doing it straight away, and we'll come up with a plan B for you.